credulity. So Florida and Arizona, get your act together on the Gulf. Just not on. Seriously not on. People are dying here. I'm getting angry. Centre for Disease Control advice mouth and nose covering. Now this is new and very interesting. So the Centre for Disease Control is now saying that it advises mouth and nose covering, but not with medical masks, because it wants to leave those available for professionals to use in the healthcare situation. So it's saying make your own masks. So that's the Centre for Disease Control. They are the experts in the United States. Now, Dr. Fauci, who's become one of the faces of this pandemic, I must say, albeit he works in very difficult circumstances, often in very difficult company, but he's talking a lot of sense. And he's saying asymptomatic people can spread the virus by speaking. Now, a couple of things to say there. This is the graph we looked at in the last video. So what he's saying is that people that are asymptomatic or pre-symptomatic, before they have symptoms or without symptoms, are infectious in this period here. So that's day one, when someone starts to feel ill. So before here, in this time, the person does not feel ill. After this time, the person does feel ill. And often for a couple of weeks after that, some time after that as well. I'm talking to a friend today who's now in day 10, who still feels pretty bad, still got a fever. And in fact, we know that most complications occur in the second week. In fact, day 10 is probably the most critical time for the development of complications. But what Dr. Fauci is saying, yes, people are infectious when they are feeling healthy, before day one, when they first get the symptoms. So he said that clearly, and he's absolutely right. So asymptomatic people, A just means without. So without symptoms, people without symptoms can spread the virus by speaking. Now what interested me today is Dr. Fauci used the A word. I heard him unambiguously say aerosolization. So what this means is he's happy, well, certainly not happy, I'm sure he's distressed, but he's satisfied now that you could be talking to someone as I'm talking to you now. Fortunately, we're separated by the internet, but if I was infectious now, I could be giving off viruses just in my speech because of aerosolization. And we've looked at previous studies that said aerosolized virus can stay in the air for some time, probably hours. So don't be with other people, talking to them, especially don't be close to anyone, talking to them whether you're outside or not, and especially not inside. We don't want to be in confined, stuffy places. So what Dr. Fauci is saying is that the masks are to protect others from me. So I'm wearing a mask to protect you, rather than to protect myself. You are wearing a mask to protect me, because you might be infectious. Therefore, I don't want to catch it. So if you're wearing a mask, you're less likely to infect me via speech and aerosolization, small particles of the virus that can hang in the air. And I want to support Dr. Fauci and the American Centre for Disease Control 100% on this. This makes perfect sense that we wear a mask to protect others. Certainly during close transactions, although they should be at least 2 meters away. All the more dangerous inside in poorly ventilated areas. Now, Dr. Fauci is also saying clean objects and door handles. Now,